polishing of restorative materials. The main objective of operative dentistry is to restore the individual tooth to its form and functions, along with imparting pleasing aesthetics and maintaining the periodontium. A rough and uneven surface invites microbial flora and is aesthetically. Finishing is transformation of an object from rough to refined form. This procedure includes removal of surface irregularities and shaping restoration according to functional occlusion. Polishing is production of a shiny mirror-like surface which reflects light similar to enamel without creating supplemental films by addition of wax or lacquer. In finishing, the substrate particles are removed by cutting or grinding. In cutting, bladed instrument is used. Grinding is done by action of bonded or coated abrasive instruments. Both these procedures produce unidirectional scratches. Polishing acts on extremely thin region of surface, producing fine scratches visible only under high magnification. During polishing of metals, highly stressed microcrystalline layer is formed called BLB layer. It is a pseudo-liquid layer composed of non-oriented crystals on restorations. Due to rapid movement of polishing agent, the top layer gets heated, causing it to flow and fill the scratches. Buffing is a terminology which refers to polishing process in which abrasives are applied via bristle brushes, treated leather or cloth material. Harder the material, higher should be the speed. For example, chrome cobalt would require more speed than gold restorative materials. A polished surface can also be obtained by placing a coating on an object. For example, electroplated deposits, wet and fissure sealants, unfilled resin glazes. Fluorosis, amelogenesis imperfecta, incipient carious lesions where defects are 0.2 to 0.3 mm of enamel. This technique was recommended by Mikulski in 1984 for removal mainly of stains caused by fluorosis by use of 18% HCl on stained surface with help of cotton pellet. In 1986, Kroll and Cavanaugh modified this procedure by using controlled HCl acid pumice abrasion, which is now commonly called as microabrasion. Here, the material is applied with the help of rotary rubber cup with fluted edges. Topical fluoride solution can be done later. Kroll later modified this concentration from 18 to 11% and increasing abrasiveness by using silicon carbide particles in water-soluble gel paste. Recently, a new system called Airflow Handy, which uses sodium bicarbonate as abrasive agent with compressed air, has come into the market. Macroabrasion. It is used for treatment of surface stains and defects. Here 12-foot fluted carbide burr is used, or micron diamond point revolving at high speed is utilized. Adequate air-water spray should be used as coolant and for visibility. Light intermittent pressure should be used. Remaining defect, if present, is removed by 30 fluted carbide burr. Final polishing is achieved by abrasive rubber point. Burnishing is a process of rubbing a metal over restorative material to make it shiny and lustrous. It aids in adaptation and compaction of material at margins, mostly for amalgam, gold foil restorations. It's carried out from restoration to the tooth surface. Steel instruments are commonly used. Tips available in various shapes. For example, bell, egg, apple, beaver tail, or conical shape. Sparkly burnisher is used for proximal gingival margins. Engine-driven burrs with smooth head can also be used. Burnishing of amalgam restorations. In amalgam, burnishing is done by rubbing a smooth instrument over setting or set material to produce a smooth, shiny surface. Less force is required to burnish a setting amalgam than a set amalgam. A round burnisher of appropriate size is often moved in light strokes from the amalgam to the tooth surface on the occlusal and other accessible areas of the restoration. Care should be taken that excessive pressure should not be applied, which may lead to heat generation. Temperature beyond 60 degrees centigrade can cause pulp damage and release mercury to the surface. The presence of mercury-rich layer at the margins will promote corrosion, which may in future lead to fracture of the same. May et al. Suggested 2 times for burnishing amalgam restorations. They are pre-carve burnishing and post-carve burnishing. Pre-carve burnishing is done before the carving is initiated and is a continuation of the condensation process. Large egg-shaped or ball burnisher is used with a pressure equal to that used for condensing amalgam. Head of burnisher contacts only the cuspal slopes and not the margins. Systematic overfilling and burnishing of margins and subsequent removal of the excess by carving can obtain an optimum structure of the restoration margins. Pre-carve burnishing increases the resistance to marginal failure by producing dense amalgams at the margins. Post-carve burnishing is done after the carving is completed. Small-sized burnishers are used with light strokes. There is increased surface hardness, decrease in the size and the number of voids on the surface and marginal areas. A slower rate of corrosion, denser amalgam at the margins, and improvement in the marginal pressure across the metal surface to the tooth. The metal is pushed to close the voids and to get smooth margins. The pressure and rubbing gives the gold its shine. Burnishing also increases the hardness of the surface by cold working. Burnishing of cast gold restorations, some amount of force needs to be applied when burnishing a cast inlay. This should be performed until no interruption is felt on running an explorer over the tooth casting interface. When zinc phosphate cement is used for cementing the cast inlay, burnishing should be done after 24 hours to let the cement dissolve at the margins and have gold tooth interface at margins. If the cementing medium is glass ionomer or resin cement, the burnishing can be carried out immediately after setting, since these cements are less soluble in oral fluids. Various objectives of finishing and polishing: obtaining adequate adaptation and continuity of the restoration margins with the tooth, optimum contour, proper contacts, and a surface free of irregularities to make it biologically acceptable for optimum oral health, function, and aesthetics. Smooth surfaces are easy to clean during the daily oral hygiene regime. Oral function is enhanced as food glides over the finished restoration easily. Reflects light similar to that of tooth enamel. Health hazards during finishing and polishing: production of aerosol, dispersion of fine solid or liquid particles, potential source for chronic and infectious disease of the lungs, eyes, and skin, may remain suspended in the air for more than 24 hours, promoting cross-contamination. Silica, common component of restorative and polishing materials, can cause silicosis. The health hazards can be minimized by adequate ventilation, self-protection by safety glasses with side shields, disposable face masks, and gowns. Thermal decomposition of sealants, acrylic resins, and composites produces monomer vapors. These vapors lead to alveolar irritation and tissue reactions. The production of vapors can be minimized by using low speeds and intermittent cutting. If using high speeds, copious air-water spray should be used. Inhalation of these vapors should be prevented. Reactions. Temperature rise by as much as 20 degrees centigrade may occur during finishing and polishing. If the remaining dentine is less, this heat is rapidly conducted to the underlying pulp. This can be minimized by proper use of coolants. Cup brushes should be preferred for polishing. Intermittent polishing at low speeds is also advocated. Soft tissue injuries may be injured if adequate care is not taken to protect them.